Diabetes is one of the most common diseases in the United States. Though strangely enough, as common as it is, if you were to ask a random group of people, what is diabetes, what are the causes, and how many types are there, not everyone will be able to answer those questions. My hope for tonight is that by the end of the evening, all of you will be able to answer those questions. According to the American Diabetes Association and the World Health Organization, diabetes is a chronic disease in which the pancreas is unable to produce insulin, or produces an ineffective insulin. Insulin is the hormone in the body that converts sugar into energy. Without insulin, the body maintains a high blood glucose level, which can cause serious health complications. In 2007, 26.5 million Americans had diabetes. 5.7 million were not even aware that they had them. Approximately 57 million adults 20 years and older were pre-diabetic. Pre-diabetic means that they had a constantly high blood sugar level, but it wasn't high enough to be diagnosed as diabetic. Diabetes is not a disease that affects just one ethnic group, though usually twice as many African Americans are diagnosed with diabetes than Caucasians. There are three types of diabetes. Type 1 diabetes, most commonly known as juvenile diabetes, because it's diagnosed usually in children and teens, is an insulin-dependent form of this disease. Type 2 diabetes is the most common type of diabetes that there is. This is not an insulin-dependent type because it can also be treated with a pill form medication. Type 2 diabetes is usually diagnosed in adults late 30s, early 40s, but can be diagnosed anywhere from your 20s and up. The third type of diabetes is gestational diabetes. This type of diabetes is only diagnosed in women, pregnant women, usually in their 28th week. Gestational diabetes can lead to serious complications during pregnancy. The most common complication is a high birth weight, which can lead to complications during delivery. We've already talked about the two most common treatments for diabetes, insulin and pill form medication. This, along with a healthy diet and regular exercise, help diabetics to keep their blood glucose levels into a safe area. There are many warning signs of diabetes: extreme thirst, frequent urination, drowsiness, sudden vision loss, and sudden weight loss. Diabetes can be diagnosed with a simple blood test as long as you go to see your doctor. Diabetes is a disease that has the possibility of many complications, such as heart disease, stroke, kidney disease, blindness, high blood pressure, and kidney disease. Though with proper treatment, exercise, and a healthy diet, the chance of these complications is lessened. According to the CDC, diabetes is the 7th leading cause of death in the United States. Most diabetes-related deaths are due to cardiovascular disease. 68% of these deaths are due to stroke and heart disease. The cost of diabetes is approximately $174 billion a year. This covers health care, treatment, supplies, and payouts for premature death. If you're a person who has a history of diabetes in your family, or if you're a person who's obese, you have a greater chance of being diagnosed with diabetes. And while there is no way to prevent this, there is a way to lessen your chances of one day having it, and that's through a healthy diet and exercise. Even 30 minutes a day can help to lower your blood glucose levels and lessen your chances of having this disease. Diabetes is a disease that affects a growing number of people every year, and while there isn't a cure, through regular treatment, diet, and exercise, most diabetics are able to live normal, healthy lives.